Have you ever wondered about the silent predator lurking in the shadows of our health landscape, tuberculosis? Well, let's shed some light on this mysterious ailment. Tuberculosis, commonly referred to as TB, is a bacterial infection. The culprit behind it is a tiny but potent bacterium called Mycobacterium tuberculosis. This bacterium primarily targets our lungs, turning them into a battlefield. Despite its preference for lungs, it doesn't shy away from invading other parts of the body. Now that we know what tuberculosis is, let's delve into the symptoms. Early detection is key in the battle against tuberculosis. Recognizing the symptoms is the first step towards this. So, what should you be aware of? Well, tuberculosis often begins subtly. It may start with a persistent cough, one that lingers for 3 weeks or more. This isn't your average cough, it's persistent and often accompanied by chest pain. But the symptoms don't stop there. Unexplained weight loss is another common sign of tuberculosis. Your body is fighting a battle, and this can lead to losing weight without trying. Then there's the symptom that's harder to ignore: coughing up blood. It's a symptom that's as alarming as it sounds. This can occur when tuberculosis severely affects the lungs. These symptoms might be easy to overlook individually, but together they paint a picture of a possible tuberculosis infection. If you notice these symptoms, it's time for a diagnosis. Diagnosing tuberculosis involves a series of tests. To unveil the presence of this elusive bacterium, doctors typically employ a two-pronged approach. The first involves a chest X-ray, a non-invasive procedure that can reveal abnormalities in the lungs indicative of tuberculosis. However, an X-ray alone isn't enough to confirm a diagnosis. That's where the second part comes into play: the sputum test. This involves examining a sample of mucus coughed up from the lungs under a microscope to look for the telltale signs of the TB bacteria. Sometimes a CT scan may also be used to provide a more detailed image of the lungs and detect tuberculosis in its early stages. These tests are essential as they help doctors not only confirm a tuberculosis infection, but also determine its extent and severity. Each test provides a piece of the puzzle, and together, they paint a comprehensive picture of the patient's condition. Once diagnosed, treatment can begin. Treating tuberculosis involves a strict regimen of antibiotics. This is no quick fix. It's a journey that requires unwavering commitment and consistency. The standard treatment for this disease can stretch over several months, and it's crucial to follow your doctor's instructions to the letter. A typical treatment plan includes a combination of antibiotics such as isoniazid, rifampin, and ethambutol. These powerful drugs work in synergy to combat the TB bacteria, each playing a vital role in the healing process. Isoniazid and rifampin are the heavy hitters, attacking the bacteria directly, while ethambutol safeguards against the development of drug-resistant strains. Now you might be wondering, why so many months of treatment? Well, the TB bacteria are tenacious. They can survive in a dormant state in your body, and it takes time for the drugs to seek out and destroy each one. This is why consistency in taking your medication is vital. Stopping early, even if you start feeling better, can lead to drug-resistant TB. However, as with any medication, these antibiotics can have side effects. These may include nausea, jaundice, or even vision changes. Regular checkups with your healthcare provider are essential to manage these potential issues. They can adjust your treatment plan if necessary, ensuring you're on the most effective and comfortable path to recovery. In the fight against tuberculosis, completing your treatment is the first step towards victory. It won't always be easy, but with perseverance and the right care, you can overcome this ancient adversary. Tuberculosis is an age-old disease, but our understanding and treatment options have evolved significantly. This bacterial infection caused by Mycobacterium tuberculosis can impact our lungs and sometimes other parts of our body as well. Key symptoms to watch out for include a persistent cough, chest pain, weight loss, and coughing up blood. Diagnosing TB involves a combination of chest X-rays, sputum tests, and occasionally Connecticut scans. If TB is detected, there's no need to panic. With a consistent regimen of antibiotics such as isoniazid, rifampin, and ethambutol, the disease can be treated effectively. But remember, it's crucial to complete the full course of medication to prevent the bacteria from developing resistance. Like any medication, there can be side effects, but regular checkups with your healthcare provider can help manage these effectively. Tuberculosis may be an ancient disease, but with modern medicine and awareness, we can tackle it head-on. Prompt medical attention and consistent treatment are our best defenses against tuberculosis. Stay informed, stay healthy.